Health practitioners demanding tools for their trade. Public hospitals such as this one have come under fire for allegedly forcing employees to screen patients without any protective gear.
Some of our members are forced to screen suspected patient without proper mask. You see the mask that I'm wearing, it's N95. It's proper for health workers to be able to wear it. We have been communicating with the department to say they must make sure that all the PPE are being supplied.
The union says workers will be forced to down tools if no immediate action is taken.
We are saying to the government, they must make sure that they communicate, they provide within few hours, because you can't expect them to work. Some of the employees are saying they can't risk their life and go and work if there's no PPE, and we agree to say you can't risk your life.
The provincial government says it is aware of the shortage of the N95 masks.
So other countries do have the challenge, and also the embargo that has started in our country is reported by some suppliers that it is giving them difficulty getting the supplies.
The department says it will invite concerned unions to a teleconference to discuss their grievances. Simpiwe Makanya, SABC News, Durban.
Well, now let's get an update from this. Let's speak to the Premier of KwaZulu-Natal, Sihle Zikalala, who's joining us on the line. Premier, good evening and welcome to The Full View. Just quickly, before we touch on that particular story that we just read now, just tell us about the measures that the province have put in place, considering that some people have started moving around, even though there has been a call on people not to move around between provinces.
Well, the first thing, we will want to thank the people, because generally the majority of the people did listen to the call by the president. In the province, all people, majority of the people are at homes, and they are not moving up and down. But we've added the law enforcement agencies and complemented with soldiers, and yesterday we were with them. And they are deployed all over KwaZulu-Natal. So there is adherence in most of our areas.
Mm-hmm. Are you concerned at all, though, Premier, that considering that Gauteng currently has the highest number of infection rates compared to any other province, that people moving in between the two provinces could actually transmit the virus into the province, and the province could just see an escalating in the number of confirmed cases?
Not only transmitted between provinces, but even between cities, moving from one city to the other. That's why we are saying all of us, let us be locked down at home. Let us work from home. Only those who do emergency services should be allowed to go to work. It is concerning that people are moving all over, and we are not going to accept that. When it comes to KwaZulu-Natal, there are roadblocks all over, and we don't want to allow people moving from one area to the other.
The last time you spoke about people not adhering to some of these rules, you indicated as well that 24 people had been arrested, and this was yesterday. Has that number increased?
It continues to increase. Just yesterday, in one of the roadblocks that I was part of, we arrested 3 additional people, and 12 others were given traffic fines. So the number is continuing. But I would say from yesterday and today, there is an indication that many people are now adhering, and even those who have not, who thought they would take chances, are now mindful that law enforcement agencies are around.
Yeah.
And I think we must thank councils because in KwaZulu-Natal, we issued an instruction to all councils that they must conduct loud hailing, conscientizing and requesting people to stay at home. And I think that message has assisted us.
So, Premier, as it stands as well, we understand that earlier on today as well, that there was a factory which the police have pounced on, and they found that 14 people were forced by their employer to work and sleep at that particular factory since Monday. 14 people, I understand, have now been released and allowed to go home. Can you just quickly describe to us what the situation was there and why these members or these employees were being kept at this factory?
I think the problem was that the employer and the employees made a wrong agreement. It is wrong to coerce workers to stay at the factory, especially when conditions are not in a state where they will be protected in terms of their health. And that's why we've locked that company, and that's why we said those workers must go back home up until the lockdown period is over. We're not going to allow a situation where some companies would just open and keep workers. It is that one, but there are a number of companies, especially in the clothing and textile industry, that seemingly wanted to do the same. But we issued a clear message, and I think all of them are adhering to the message.
Do you think, although, of course, this factory and the owner of the factory has transgressed the law and has also not adhered to the working conditions that these workers must be working under, that considering that this is a factory that produces and manufactures facial masks, that the province itself could also find itself in a very precarious position in trying to procure some of these masks that are highly needed?
Yes, but if they wanted to work, they could have done that in the best way, where they would be clear that they are providing emergency services such as facial masks, which, by the way, that company we know because they have even contributed. They've managed to make some donation, and we think they should have done a proper thing to apply according to the procedures that are in place, engage DTI, and then work following proper processes.
But for now, as it stands, the company is shut down. No operations will be allowed to continue there up until after the 20th.
It's a company that is known to the Trade and Investment KwaZulu-Natal and the government, and therefore we will be interacting with them to follow due processes.
Okay. And Premier, on that particular story that we started off this conversation with, and this is the hospital where people are complaining that they don't have the necessary protective gears. This is not the first time that you're receiving this complaint, but also from other health facilities as well. What's being done there?
Well, we know that in some areas, as of possible Friday, there were no sufficient masks. But we know the Department of Health had procured masks, and I think by now they should have arrived. And they were going to be distributed to all hospitals and health facilities in KwaZulu-Natal. That include all protective clothing that are needed. And that's why we are saying we believe that that problem, yes, it was there, but we are addressing it.
Okay, then. Thank you so much. That is the Premier of KwaZulu-Natal, Sihle Zikalala.